Hey guys, Jim Hoffman here again from Turbomedic, and I want to do a few videos about bleeding. And I know a lot of it is common sense. You might say yourself, oh, bleeding, just pressure on the wound and we're good to go. But I want to give you some key references because it's going to be important. You might see some of this stuff on exams. Basically, we talk about bleeding or hemorrhage. This is or can be a critical condition, and it's something that we encounter a lot as EMS professionals. So understanding the management of bleeding, both internal and external, it really is essential for us to provide effective emergency care. So these videos are going to explore lots of different aspects of bleeding management, including even talking a little bit about the hemostatic agents and tourniquets that you might see. So this video, I want to focus more on understanding blood volume and blood loss. And so it's going to be a quick one, but this is type of the stuff you might see questions about this on exams, and it's good just to kind of have this as a kind of a foundation for you when it comes to your patient care and what your understanding is going on. So adult blood volume, I always get jammed up saying that stuff, but the average adult has about 70 milliliters per kilogram of blood, and women have about 65 milliliters per kilogram of blood. So on average, a 175-pound male has about 6 liters of blood. Now we talk about blood loss tolerance. The body can't tolerate a lot of blood loss. About 20% or more, we have a problem. So signs of significant blood loss for a patient, you're going to see them going into shock, elevated heart rate, or elevated respiratory rate, hypovolemia, hypovolemic shock. So keep in mind that you got to keep that, you don't want to get that blood loss to the point where they're going into shock and you have significant issues, right? You want to keep it down so that you don't end up getting to those points. On the other side of that are the pediatric considerations when it comes to blood loss. We have to keep in mind, we don't encounter pediatric patients that much in the field. So it's important to kind of understand this stuff and kind of keep it in the back of your mind. So if you have these patients, you know how to act appropriately and you know what to look for. Children, pediatrics have a much lower blood volume, right? That makes sense. Of course, they're a smaller body. So for instance, a 1-year-old child has maybe about 80 milliliters of blood. Even a small amount, let's say 100 milliliters of blood loss, can be pretty significant for a pediatric patient of that size. Just some stuff to keep in mind. Now, in the next video, I'm going to talk a little bit more about blood and blood types and different types of blood loss and stuff like that. But for now, I'm going to end it real quick on this video. But if you want more free study information, guys, go check out Turbomedic Insider. Lots of tips and resources to help you in your EMS goals. You can grab it all. It's free over at myturbomedic.com. As always, Jim Hoffman from Turbomedic. Stay safe.